Alright, in this video I'm going to be inducing anesthesia and then performing a dental on a canine. I've already inspected all of my equipment and it is functioning properly. We have an IV catheter already placed, and it was placed by shaving the area, and we used a aseptic technique putting it in. I have my induction right here. We're using TTD. Lena, can you grab me a flush? And what we want to do is we want to give half of the dose bolus, and then we're going to slowly give the rest of it until effect. Alright, we're going to wait for him for the drugs to kick in, and then we're going to be watching for a swallow reflex so that we can place an intubation tube. Come on, buddy. I've already lubed my ET tube, and I've checked my cuff to be sure that it's doesn't have any leaks and is functioning properly.
Dr. Helen, Carrie from Hippo called back for you. I said you were in a room, so she said whenever.
Do you guys want to
there's
go
her
from the
number.
gas station?
He's going down now. Once he doesn't have a swallow reflex anymore, I'm going to ask the assistant to hold our, we're going to be sitting sternal, and we want to hold our head and neck extended up. We want to make sure that we don't put our hands inside of the mouth. You can either use tie gauze to wrap around the top muzzle to hold up, or you can use the lips of the muzzle to hold up. It's not quite there yet.
Yeah, no, we're just walking right now. I'm about to go to the gas station.
While we're waiting on him to go down, I'm going to just go ahead and lube his eyes.
I've already walked everybody else's.
Alright, I think we may be there. I'm going to ask the assistant to hold her head up. And I've already measured our ET tube so that we know where we're going to be tying. It looks like on him, we're going to be tying, we want this to go, since we're tying behind the ears, we're going to attach it in this position right here. And we want to do a half hitch knot on the actual ET tube, and then when we tie behind the ears, we're going to use a quick release knot.
I left your doggy's thing open. I let him out though. Thank you. He likes to run. Yes.
Alright, since his tongue is inside the mouth, we don't want to reach our hand inside of the mouth, so we're going to use the Murphy's hole in the ET tube to grab a hold of the bottom jaw to make sure that he's not going to be able to clamp down on us. I'm going to ask the assistant to hold my tongue as well. We have the epiglottis right there, and we want to open the epiglottis. We can see the larynx opening and closing. Alright, so we want to ensure that we are in the trachea. It looks like we are. So we can go ahead and put him on anesthesia. I've already put the appropriate size bag on and the appropriate size circuit. We're going to put on 1 ISO and 1.5 of, that's okay, 1.5 of the oxygen, 1.5%, 1.5. We want to inflate our cuff. The way you want to inflate your cuff is to do a small amount at a time until you get a balanced pressure in your syringe. And what I mean by that is you want to have enough to where that syringe is pushing back on it. And the reason we want to do that is so that we don't cause pressure necrosis in the trachea. So we are under anesthesia, oxygen on, ISO on, bag, cuff inflated. So we're going to get started on the dental now. I'm going to go ahead and put all of my protective equipment on, which is going to be gloves. You know what a mask is? Yes. So I've got gonna be wearing a mask, and we use face shields instead of goggles. I've already gotten my dental machine ready to go. Alright, so the first thing that we want to do is to use our probe, and we're going to check for any swelling, hyperemia, fistulas. We also want to check for any fractured or missing teeth. Sorry, I gotta take my glasses off. They're fogging up underneath the mask. So we definitely don't have any deciduous teeth. It doesn't really look like we have any swelling or anything to that nature. We also have our anesthesia monitoring hooked up now. Alright, so now we're going to use the scaler. Alright, so we're going to use the probe, look for any type of swelling, hyperemia, fistulas, fractured or deciduous teeth. We'll also, if we find anything, we're going to notate that in the patient's chart. I'm not seeing anything in particular other than we do have some calculus buildup on the crown of the tooth. So we're going to use the scaler to remove the calculus from the crown of the tooth. Always want to be sure that our cuff is already inflated, and we also want to put the patient's head to where the rostral end of the muzzle is lower. Some of the other things that we're going to be looking for is we're going to be seeing if there's any asymmetry to the occlusion of the teeth. And we want to notate that in the chart as well. It's important whenever your patient is under anesthesia to make sure that you're keeping up with the anesthesia log with all of their vitals. You want to watch for apnea or decreased heart rate, cyanosis. Any of those could potentially mean that there's a problem. Well, there is a problem if any of those are happening. I'm going to finish scaling these teeth, and then once we get on to the next step, I'll continue recording. Alright, so I went ahead and turned our patient over so that I can scale on the... So basically, if they're laying on their left side, you want to do the right side of the outside, and then you're going to do the left side of the inside of the teeth. That way that you're not missing any aspect of the teeth. Then you're going to flip them over and do the exact opposite. So I went ahead and flipped this over. Also, we have an anesthesia machine hooked up to us, monitoring our heart rate and SpO2. It was kind of fluctuating a little bit, so I just went ahead and grabbed the stethoscope and listened to us. We have a good heart rate, we're doing good, but you never want to completely trust your anesthesia machine, because ultimately it is just a machine, and your best tool is going to be your stethoscope. So I'm going to finish scaling this side, and then I'll start recording him. Alright, now I'm going to polish the teeth. One of the most important parts of doing a dental is polishing. It's actually considered medical malpractice if you do a dental without polishing the teeth. So you just want to go through and make sure that you do the crown of every tooth. And basically what this is doing is it's going through, and any type of scratches that you put in the enamel of the tooth, this is going through and smoothing them out. So those little indentations are sources for bacteria and debris to build up.
way and going up it that way, and that's the area that hurts. So, I mean, really, it really doesn't also want to do it. There's so many, there are so many, probably probably there was a colitis or something that happened that triggered it. So we've got a whole host of genetics, the microbiome, all, all of it together. It's just it's a whole multitude. But that's what I think. I don't think she has
So I'm basically just going through and polishing every angle of every tooth
Charlie, did you turn the water on?
just to make sure that we have
Turn the water on?
Oh, right.
Alright, I'm going to go ahead and flip this over, polish the other side. Alright, so I've gone through and polished the crown of each tooth. Now I'm going to use water and rinse all of the polish off, any calculus that we have gotten off, any type of debris. I'm going to make sure everything is clean and fresh. Then we're going to take us off of ISO. I like to do this on just oxygen just for a few minutes until we start waking up.
Yes.
We want to make sure after we turn the ISO off, we make sure that we deflate the cup. We can cause damage by removing the ET2 extubating while the cuff is inflated.
I'm kind of hoping that maybe she doesn't have to live on campus that first year.
Yeah.
You want to make sure also that you're not only just rinsing the teeth, but you're also rinsing the entire gum line.
She doesn't know.
Yeah.
She's pretty wide open. Whoever she gets the most financial aid.
Let me get you, girl.
I'm going to go ahead and deflate our cuff. And once we start showing a slower reflex, then we can extubate.
She might have to go out.
And that video was the induction, intubation, and prophylaxis on a canine.